And talking health now, the federal government has been asked to institute glaucoma care into the National Health Insurance Scheme to provide access to the care at the grassroots by rural dwellers to help in addressing issues of blindness in the country. This advice comes from the 24th annual lecture of the Faculty of Ophthalmology of the National Postgraduate Medical College of Nigeria. Senior correspondent Jacqueline Ogo has more.
It takes a lot of courage to live when the true beauty of life cannot be savored due to blindness.
The mother is ill during pregnancy.
That is why experts of the Faculty of Ophthalmology of the National Postgraduate Medical College of Nigeria are calling for attention and early eye checks for the detection of the world's leading cause of irreversible blindness, glaucoma, known to be a silent and aggressive destroyer of human sight that has no medical cure. Glaucoma occurs when the optic nerve is damaged due to lack of blood flow, and it is the optic nerve that sends visuals to the brain for the interpretation of images.
It runs an aggressive course in blacks. You just see blacks, they go blind so quickly. Within 20 years, if you don't do anything, that person is blind in both eyes. And it's easy for the person to go blind because it doesn't affect the vision that is ahead of you. You want to go and see maybe one optician and he says, read all those letters. Are you able to read it? Or he gives you even the tiniest of letters, you can read it. But that does not exclude glaucoma because it affects the peripheral views at the very early stage. At the late stage is when eventually it creeps to your central vision. And that is the stage at which a lot of people come. And by that time, they would have lost like 98% of their vision.
Although doctors can't confidently say the causes of glaucoma, the genetic composition of a person, a poor feeding habit and dangerous lifestyles like smoking, the intake of excess alcohol are suspected causes. 60% of persons with glaucoma are in Asia and Africa. That's because experts say black people are highly susceptible, with the men having the higher rates of prevalence. Professor Onokoya says to curb the rate of blindness in Nigeria, the government must entrench glaucoma into the NHIS for access at the primary healthcare level by the poor in the grassroots, and should provide the equipment for diagnoses, which are expensive.
If we integrate glaucoma care at the primary level, people walking into health centers in their villages, they get checked for glaucoma. And that way, we can reduce the number of people going blind from glaucoma.
People who have high blood pressure are advised to take their drugs and check their eyes constantly against glaucoma, as well as people who are obese and the elderly. Despite these admonitions for vision care, the chairman of the lecture says there is another type of vision that must not be lost.
To help those who have eyes but cannot see, and not because they are blind, but because they occupy positions where, whether as leaders, whatever, they don't have vision. And once you have leaders who don't have vision, there are severe limits as to where they can take the organization or the business or even the country.
Now, one must step back into eye care.
Doctors say some people die due to depression arising from the loss of their sight. And pain emanating from an incurable ailment is not one to be desired by any. That's why medical advice on early checks of the state of the eyes should not be ignored. Jacqueline Ogo, TVC News, Lagos.